Okay, so hello, good day, and welcome to the Group 1's discussion of the timeline of major scientific discoveries and technological development in the nursing course. So my name is Magpayo and I'll begin the timeline in the early 18th century. So nursing is an ever-changing field. So when we think back on what nursing was like years ago, we realize how much it has changed. From technology advancements, more independent training, structure of medicine, and an increase in nurse practitioners. There are just few of the game-changing changes that have occurred in the last few decades. So it's possible that we've witnessed some of these changes in our own lifetime. So recognizing these changes is a critical component of appreciating a modern nursing as it is today. So the first entry was the invention of the stethoscope by a French physician named René Laennec, which forever changed medical examination since its invention in the 1816. René's groundbreaking stethoscope has saved countless lives. So prior to its invention, physicians and nurses performed physical examinations and assessments solely by listening with the human ear. So this was far from the ideal because the internal sounds were not amplified and were frequently muffled, and the technique relied on the physician's hearing and ear placement position. So it was also inconvenient for both the physician and the patient. So the result was far from reliable. So the stethoscope solved all of these problems at once, then forever changing the way patient diagnosis was performed. So it is also one of the most important tools in the hands of doctors and nurses. So the second is the 1867, which the antiseptic theory was developed, which also has saved countless lives since then. So a guy named Joseph Lester developed the antiseptic principle of the practice of surgery and was first published in the 1867. So this was a pivotal moment in medical history that would eventually lead to a cleaner operating rooms and higher patient survival rates. So he was convinced, and rightly so, that the cleanliness during the surgery was critical to the procedure's effectiveness and the patient's subsequent recovery. So this was revolutionary thinking at the time. Lister developed many antiseptic surgical methods, particularly the use of carbolic acid to clean wounds and instruments. So the effectiveness of his techniques was immediately recognized by his peers and were quickly adopted. So surprisingly, after implementing his procedures, one hospital saw a reduction in infectious disease death rates from 60% to a paltry of 4%.
The discovery of X-ray. X-ray came from the German physicist who discovered the electric current to discover the X-ray. He is Wilhelm Conrad Roentgen. Born on March 27, 1845 in Linny, Prussia, or also known as Rim-shaped Germany. Died on February 10, 1923 in Munich, Germany. He is a recipient of the first Nobel Prize for Physics in 1901 for his discovery of X-ray. It heralded the age of modern physics and revolutionized diagnostic medicine.
In 1895, Wilhelm Conrad Roentgen he discovered the X radiation on November 8, 1895. The newly type of radiation, it is essential to emergency medical diagnosis. X-ray first used on the battlefield to identify immediately where part of the body to find the bullets and broken bones. X-ray radiation became a major diagnostic tools in medicine, allow the doctors to see internal human tissue and structures without having surgery.
He took the first X-ray photographs of the interior of the metal of objects and of the bones of his wife's hands. His research also included work on elasticity, capillary action of fluids, specific heat of gases, conduction of heat crystals, and absorption of heat by gases, and piezoelectricity.
So in 1924, the electroencephalogram or EEG was first developed by Hans Berger. This is a type of test that detects abnormalities in your brain waves or activity of your brain. Hans Berger actually first recorded the human electroencephalogram, charting electrical activity using his son's brain.
In 1925, Marius Smith Peterson introduced the three flank nails to secure the bone in
fractures.
So another invention is from 1928 called the iron lung. This was developed by Dr. Philip Drinker and Dr. Louis Agachi Shaw. This was actually originally known as a Drinker respirator to improve respiration of polio patients. This is a type of negative pressure ventilator, a mechanical respirator which encloses most of a person's body and varies the air pressure in enclosed space to stimulate breathing.
The portable defibrillator. Until 20th century, the only method available for reviving a patient whose heart had failed was a manual CPR. Then in 1930, the external defibrillator, as known today, was invented by electrical engineer William Cohen-Hoven. As a student of Johns Hopkins University's School of Engineering, Cohen-Hoven studied the effects of electricity on the human heart. What he learned led him to develop an external device that can jumpstart the heart. Dr. Claude Beck first used the defibrillator on a 14-year-old patient in 1947 and was so successful in saving his life. After undergoing numerous updates and improvements, the defibrillator reached its modern form that people know today. The latest version, called Automated External Defibrillator, or AEDs, are found in a variety of public places, including malls, airports, office buildings, community centers, and public transportation hubs. They include a detailed instructions on how to use the device, and was so easy that even children can save a life.
In the year of 1955, Jonas Edward Salk was acknowledged for being the first person to successfully come up with the polio vaccine. Before Jonas invented the polio vaccine, polio was a life-threatening and a scary disease in most parts of the world. The invention of the polio vaccine is one of the most notable inventions in the medical field. Its invention led to a great breakthrough in the fight against polio, which was one of the leading causes of deformities and deaths in the world. Polio is known to paralyze limbs of individuals who are not vaccinated against it. The individuals are left with an inability to walk and conduct vigorous physical activities, such as one of our national hero, Apolinario Mabini, who lost both of his legs to polio. In some extreme cases, victims of this disease ends up dying.
A blood glucose meter, it is a small portable machine that used to measure how much glucose is in the blood. People with diabetes often use a blood glucose meter to help them manage their condition. The Amis reflectance meter was the first blood glucose meter. It allowed patients with diabetes to self-monitor their blood glucose level. The Amis reflectant meter was developed in 1970 by Anton H. Clemens. It had a needle that indicated the intensity of blue light reflected from a paper strip called dextrose sticks. The meter gave a quantitative number that was correlated with glucose level in blood the dextrose was exposed to. The dextrose was developed about a decade earlier. It was a paper strip with chemistry embolizing to it. When the paper strip was dipped into the blood, it changed of color to the shade of blue. The exact shade of blue was dependent on the level of glucose in the blood.
I am Jairah Roncales from Group 1. I will discuss the development of science and technology in nursing field from 1960 to 1989. In the 1960s, technological advancements involving the new medicines, particularly the antibiotics, the IV therapy, and the administration of blood products become available on that time. From 1965 to 1980, machines of all kinds from dialysis to cardiac monitors to fetal monitors and automatic recording devices was invented. And from 1980 to 1989, technological advancements include the automated oscillometric blood pressure cuff was invented. In 1981, the first fully automated oscillometric blood pressure cuff was invented by Dr. Donald Nunn. Dr. Donald Nunn is an oral and maxillofacial surgeon in Marietta, Georgia. This device provides automated oscillometric blood pressure measurement. It measures the mean arterial pressure, by which the systolic and diastolic blood pressure are then calculated using the algorithm. The device is accurate in identifying preeclampsia, and requires limited training. The oscillometric blood pressure measurement is significantly underestimates arterial blood pressure and exhibits a high number of measurements out of the clinically acceptable range.
In 1990s to the present, science and technology in the field of nursing and medical profession progress as it faces the evolution of technology. Many innovators look for the best way to find a solution to the problems inside the medical workplace and give the medical personnel the equipment and devices they need to make their job safe and easier to the clients. So one of this example of discovery in 1990s is the Angiesil. The Angiesil is a breakthrough vascular closure device that uses bioabsorbable components to mechanically seal punctures in the femoral artery after the catheterization procedure. The quick seal occurs in 3 easy steps: locate, set, and seal, and is created by sandwiching the arteriotomy in the tissue tract between a copolymer anchor and a collagen sponge. In addition to providing patients with a shorter hospital stay, the seal dissolves within 60 to 90 days. The device was developed by Kansi Nash Corporation, which licensed it to the St. Jude Medical. The next discovery is the safety syringe. During the late 1980s and into the 1990s, the most frequent cause of bloodborne infections in healthcare setting was a needle stick. Safety needles have come a long way to help prevent such risks. The safety mechanism is often built into the needle. The needle can be manually attached to a conventional syringe or a commercially prepared prefilled syringe, and in 1998, an inventor, Thomas Shaw, developed the safety syringe to protect the healthcare workers from accidentally being infected by dirty needles. A safety syringe is a syringe with a built-in safety mechanism. This is to reduce the risk of needle stick injuries to healthcare workers and others. The needles on a safety syringe can be detachable or permanently attached, and on some models, a sheet is placed over the needle, whereas in other needles, it retracts into the barrel. Safety needles serves as the same function as the safety syringes, but the protective mechanism is part of the needle rather than the syringe.
By the year 2005, the oxymask invented and designed to overcome the common side effects of closed oxygen masks such as mucosal drying, nose bleeding, facial sores, and claustrophobic nature of the device. Its open oxygen system designs eliminates carbon dioxide rebreathing, allows patients to communicate more easily with clinicians, and enable drinking through a straw. A nasogastric tube can also be treated through the mask, and swivel elbow expands the device flexibility by allowing left to right positioning of oxygen tubing. Drones are present from disinfection and street patrols to food and medicine delivery in quarantine districts. Drones are being deployed on the front line to contain the spread of novel coronavirus. The modification of drone software by state agencies and drone manufacturers to enforce restrictive measures and to boost disease detection and crowd management makes a compelling case about the risk of pervasive surveillance and overstretched law enforcement. In the context of COVID-19 pandemic, drones are being used to monitor quarantine measures, to facilitate aerial broadcasting, to spray disinfectant, conduct aerial thermal sensing, monitor traffic, and deliver medical supplies in infected areas.